Fascia with fat, yes, protrusion goes. And then after them goes protrusion of parietal peritoneum, you may see, yes, protrusion. And finally, in sac, peritoneal sac, enters the greater omen. Contain, hormone contain. Umbilical 11%, it's an umbilical ring, yes, and structures which passes through it, cord elements. The umbilicus is one of weak areas of the abdomen and a common site of herniation. Umbilical hernias occur more frequently in women. Obesity and repeated pregnancies are common precursors, and ascites always exacerbate the problem. Umbilical hernia is adult, are acquired, and have no relationship to umbilical hernia in children. Which structures here, boys and girls? Yes, umbilical vein, which after obliteration transforms in round ligament of the liver, yes, and three structures goes downward. It's two arteries, umbilical arteries, which transforms in umbilical ligaments, medial umbilical ligaments, and between them, number 5, it's a urachus. Urachus connecting with urinary bladder. After born, it transformates, obliterates, and transformates in median umbilical ligament. Umbilical hernias demonstrates these pictures. Strangulation of the colon and omentum is fairly common. Umbilical hernia are common in infants and close spontaneously without special treatment if the aponeurotic defect is 1.5 cm or less. However, repair is indicated in infants with hernial defects greater than 2 cm in diameter and in all children with umbilical hernia still present by age of 3 or 4 years. It's a small hernia. Yes. Methods of herniotomy in umbilical hernias and hernias of linear eye. We may use Lexer operation, Sapeshka operation, Mayo operation, and repair by prosthetic, synthetic mesh prosthesis. And this picture demonstrates Lexer operation when we, after herniotomy, removal of set, yes, we around umbilical ring push some suture, tighten it, and then duplication of aponeurosis, we above first layer, we stitch it by interrupted sutures. By Sapeshka, if you want to do operation, incision should go vertical, and if Mayo, incision should go horizontal. And there we do separation of aponeurosis, one of layer, upper or left, right layer if by Sapeshka, and then stitch one aponeurotic layer under another. So we do duplication. Here demonstrates this one, Sapeshka method. Yes, we separate one layer aponeurosis stitch under the another layer, and then this layer put on it overlapping. Yes, and here Mayo. In Mayo horizontal incision and lower flap, we stitch under the upper flap. So again, duplication. Umbilical hernia operation, incision of skin and section of cutaneous flap. If it's big hernia, we should by ellipse cut the skin. Yes. No, it's a Mayo, again, Mayo operation demonstrates. Herniotomy in umbilical hernia. Yes, it's a small hernia, as you may see. This is hernia. Herniaplasty in the umbilical hernia on Mayon, again, horizontal incision and duplication of layers. Spigelian line hernias. Spigelian hernias are dental hernias occurring along the subumbilical portions of Spigelian semilunar line. Spigelian hernias are rare and unless large are difficult to diagnose because they are interparietal and contained by the aponeurosis of the external oblique muscle. Sonograms and computerized tomography often reveal symptomatic Spigelian hernias too small to detect clinically. This one, as you may see, it's an interparietal. Yes, it's a Spigelian line area. Here, hernia is situated under the aponeurosis. One layer is produced, another layer not. Well, it's a full hernia. Yes, it goes under the skin. Spigelian hernias again demonstrates these types. Large Spigelian hernia may be confused for sarcomas of the abdominal wall. Entrapped anterior cutaneous nodes of T10 to T12 produce discomfort resembling Spigelian herniation. Below the umbilicus, there are fibers of Spigelian fascia. The fused aponeurosis of internal oblique and the transverse abdominal muscle may split, permitting the peritoneum and extraperitoneal head to protrude through a slit-like defects, 316 millimeters, but to be retained by the overlaying aponeurosis of the external oblique abdominal muscle. Surgical anatomy of Spigelian semilunar line. First one, it's a Spigelian line here. Semilunar, linea semilunaris. Second, it's a linea semicircularis or Douglas line. Yes. Third one, it's a vagina musculus rectus abdominis anteriorly of vagina. And fourth, it's a fascia transversalis. Spigelian hernias demonstrates two-side Spigelian hernia called by Wolstein here, one side and another side. Reconstructive procedure, closing of hernial ring. Yes, we have so simple methods. It's a Lexel, Ruopel, Bassini method for common tissues. Reconstructive methods are directed on change of structure of hernial ring. It's a Girard, Kotsky, Martinov, Bassini, Kukujanov, Sholdais, Postemsky, Sapeshko, Mediomopic. And plastic when proper tissue is not enough. It's a synthetic mesh prothesis method by Liechtenstein, for example. That's all, boys and girls. Thank you for your attention. Our lecture is finished. You may be free.
До свидания.
Thank you,
Goodbye.
Sir.
До свидания.